Hello and welcome. Today we're diving into a rare and complex digestive disorder, Whipple's disease. This systemic illness primarily affects the small intestine, but its impact can extend far beyond, affecting the joints, brain, and even the heart. Join us as we unravel the mysteries of Whipple's disease, exploring its causes, symptoms, diagnosis, treatment, and more. So, what exactly causes Whipple's disease? The culprit is a bacterium called Trophima whipplei. While common in the environment, it only causes disease in a small number of people. Why some individuals are susceptible remains a key question. Current research suggests a possible immune deficiency may play a role, making some individuals unable to effectively clear the infection. Now let's delve into the pathophysiology, or how Whipple's disease disrupts normal bodily functions. Trophima whipplei primarily infects the small intestine's lining. This infection leads to the formation of characteristic lesions and the accumulation of macrophages, a type of immune cell, loaded with the bacteria. These macrophages infiltrate the intestinal lining, interfering with the absorption of nutrients, especially fats. This malabsorption triggers a cascade of symptoms, and the bacteria can then spread to other organs via the bloodstream and lymphatic system. Whipple's disease is exceptionally rare. Precise global epidemiology is difficult to determine, but it's estimated to affect less than 1 in a million people. It's more commonly diagnosed in white males between the ages of 40 and 60. Certain occupations involving exposure to soil and sewage have been suggested as possible risk factors, though this remains under investigation. The signs and symptoms of Whipple's disease can be quite varied, making diagnosis challenging. The most common symptoms include diarrhea, abdominal pain, and weight loss, all stemming from malabsorption. Joint pain, or arthralgia, is another frequent complaint. Fatigue and weakness are almost universal. In some cases, patients may experience neurological symptoms such as cognitive difficulties, seizures, or even vision problems. Other potential symptoms include skin darkening, chronic cough, and heart problems. Diagnosing Whipple's disease requires a combination of clinical suspicion and specific tests. The gold standard is a small intestinal biopsy. This involves taking a tissue sample from the small intestine and examining it under a microscope. The presence of Trophima whipplei within macrophages, confirmed with special staining techniques like periodic acid Schiff, APASA staining, is characteristic. PCR, or polymerase chain reaction, testing of the biopsy sample can also detect the bacteria's DNA, confirming the diagnosis. Blood tests can also look for anemia and signs of inflammation. While there aren't distinct types of Whipple's disease in the traditional sense, the disease can manifest with varying degrees of severity and organ involvement. Some individuals might primarily experience gastrointestinal symptoms, while others might have more prominent neurological or cardiac involvement. This spectrum of presentation can make diagnosis even more complex. Treatment for Whipple's disease focuses on eradicating the Trophima whipplei bacteria. The standard treatment involves a prolonged course of antibiotics. Typically, patients receive intravenous antibiotics, such as ceftriaxone or penicillin, for an initial period of 2 to 4 weeks, followed by a longer course of oral antibiotics, such as trimethoprim, sulfenthoxazole, or doxycycline, for up to a year or more. Regular monitoring is crucial to ensure the infection is cleared and to watch for relapse. Nutritional support, including vitamin supplementation, may also be necessary to address malabsorption. Unfortunately, there's no known way to completely prevent Whipple's disease, primarily because the exact mode of transmission is still not fully understood. Maintaining good hygiene practices, such as thorough hand washing, may help reduce the risk of exposure to the bacteria, but this is largely theoretical. With prompt diagnosis and treatment, the prognosis for Whipple's disease is generally good. Antibiotic therapy is usually very effective in eradicating the infection and reversing the symptoms. However, relapse can occur in some cases, so long-term follow-up is essential. Research continues to focus on understanding the immune dysfunction that predisposes individuals to Whipple's disease, developing more rapid and accurate diagnostic tests, and exploring new antibiotic regimens to minimize relapse. Recent studies are investigating the role of specific genetic markers in susceptibility to the disease. Ultimately, a deeper understanding of the host-pathogen interaction will pave the way for improved prevention and treatment strategies.